Hi everyone, Dr. Remy from Pain Free and Fit and Posture Science. Today we've got some great tips for walking with spondylolisthesis. This is going to be part one. We're going to talk about the core and what to watch for to avoid aggravating your spondylolisthesis pain. So in our previous videos on spondylolisthesis, we've talked about a few key points of core muscles and how engaging the core can help prevent the spondylolisthetic vertebra from sliding forward and compressing the back of the joints, the facet joints, the back of the disc, and help prevent pain. We're going to use these concepts today as we address walking, and especially what to do while walking uphill, downhill, and even crosshill to avoid aggravating your pain. Normally, spondylolisthesis of the lower back is aggravated when there's an excessive extension, meaning an increased arch of the lower back. That occurs because of tight hip flexor muscles, weak abdominals, and dysfunctional core muscles in the back. To help set your particular spine in its neutral position, remember we have to first figure out tail under and tail up. If you rock your pelvis tail under or pubic bone up, that will decrease that arch in the back. And you want to go to a point where you start to feel a little pulling or a little irritation in the back. That would be one extreme of your motion or range of motion that you would not want to go past. And then if you go the other way and drop your pubic bone and raise your tailbone, you'll feel the lower back begin to arch. At a certain point, you'll feel a little irritation in your lower back. That would be the other extreme. You wouldn't want to go that far in your pelvic tilt motion. So for a neutral spine, you want to put your tailbone or pelvic rock right between, halfway between those two extremes. That's your safe zone. Once that's established, we then want to engage some core muscles correcting our RPI. Now, an RPI addresses postural issues such as having your hips slightly rotated to one side, if that's your habit from, let's say, sitting or sleeping or walking that way. Your torso rotated to one side, having one hip higher than another, having a leg that turns out more, which causes that hip to be higher, having a tendency to posturally lean in to one side, if that's your daily habit, let's say sitting and working or driving. So you want to take all these considerations plus your muscle imbalances between multifidus and quadratus lumborum and internal oblique and have all these things set so that your spine is in a neutral or square position. You don't want a lopsided or asymmetrical body structure. That irritates one side by compression and another side via overstretching. So if you don't know what your RPI is, go to the Posture Size or painfreeandfit.com website. We have a free body analysis. Take it, learn about your postural distortions, learn how to set your body in its correct RPI with your neutral spine. That being said, once we get that midpoint pelvic tilt, we're going to engage those deepest fibers of our lower back, called the erector spinae. They attach to the vertebra to help it from slipping forward. That helps to check or protect your spondylolisthetic vertebra and the joints and the discs and all the soft tissues around it from having undue stress. So the way you do that, remember, is by tensing the tailbone back upwards, like you're trying to arch your back. Remember, that's tension, not motion. If you move it up further, you're going to be going towards that extreme range of motion that's going to cause pain. So once you get that halfway position, just a little extra tension moving back upwards, but not actually moving, just tensing, trying to lift it up. That creates abdominal and back tension or co-contraction between the two. When that's set, you want to engage any multifidus atrophy or multifidus inhibition. We've talked about that on different videos, where you're causing that lower abdomen as it pulls in, your transverse abdominis, to bulge out into the area of the spine that's weak. And as you hold that now, you're going to apply that to the walking pattern. Now, if we're walking uphill, and I'm facing uphill, naturally the tailbone wants to go under, the abdominals want to contract to bring us forward. That resists our tendency to fall backwards downhill, and it's a little easier to hold these corrections. But walking downhill is just the opposite, and that's where a lot of patients and clients get aggravated with their spondylolisthesis pain. I went out for a walk, I was fine, doc, until I started going downhill. My back's killing me ever since. So downhill, what we need to emphasize is once you have that perfect position, you have to emphasize more tension with the tailbone under and a little abdominal tension down. Because typically as we walk downhill and our heels are higher than our toes, it's just like wearing high-heeled shoes, that abdominal wants to lean back. It wants to prevent us from falling downhill. So we have to counter that with more abdominal tension. So as you're walking and you approach downhill, maintain that same perfect spinal position, but emphasize a little more tension, not motion, of tail under and rib cage down, and keep yourself long as you walk downhill. For side walking, let's say we're walking along the beach, let's say we're walking along a crest or a hill where we have a low side and a high side. That can create lateral problems in the spine. Typically the high side, if the higher side of the hill is here and the lower side is here, the high side is going to want to create my hip to go into a hiking position. It's going to raise that hip up, and I'm going to have a tendency to lean my torso in to the top of the hill. That prevents me, again, from trying to fall downhill. The body is always trying to reflexively balance itself. Unfortunately, with spondylolisthesis pain, as you compress one side, the facet joint in the disc becomes compressed. That many times can irritate the back. So likewise, holding that position with your spine in a neutral position that we just talked about with all those tensions, you're going to bend your uphill knee just a little bit more as you walk. So as you walk, as you take a step, you're just thinking that uphill knee is going to bend a little bit more. You can even put your hands on the top of your hips or pelvis to make sure that the hips stay level. You're going to make sure you have a little lengthening tension in the rib cage, so that side of the rib cage that's uphill is tall and not leaning in, and that way you can keep your hips and pelvis level as you traverse the side of the hill. If you like this video on walking with spondylolisthesis pain, feel free to subscribe to our channel. We got a lot of great videos out there to help you with rehabilitative and self-healing exercises to assist your body's healing mechanism and stop irritating the soft tissues in your spondylolisthesis. If you'd like to help me share this valuable information with others, give me a thumbs up below. Let's get more people with spondylolisthesis out there feeling better. Questions or comments, write in. I'll do my best, as always, to answer them. And if you're looking for a great program to learn your own self-assessment of biomechanics, how they affect your spondylolisthesis pain, and corrective exercises that are customized for you between balance exercises, coordination exercises, flexibility, strengthening, endurance exercises. We've got them all to rehab, self-rehab your back at home to allow your spondylolisthesis to start enjoying your daily activities and sports activities without pain. Look for our special spondylolisthesis fast track program available at the painfreeandfit.com website. I hope this video on walking mechanics and spondylolisthesis pain helps you with your lower back pain.